Well, more on Singapore's efforts to step up COVID-19 testing. So starting Wednesday, everyone aged 13 years and above with acute respiratory infection will be tested for the coronavirus. Cheryl Goh joins us for more on this. Tell us about this new testing strategy, Cheryl.
Well, that's right, Glenda and Steve. It's really an expansion of the current community testing criteria, which tests people aged 45 and above with acute respiratory infections. So right now, it's going to cover all adults and teenagers who have such symptoms, and they will be tested immediately when they visit a doctor instead of having to wait a few days. And this is really part of the government's overall testing strategy to detect cases early and complements the current active case finding among close contacts as well as surveillance testing among vulnerable groups. It also comes as Singapore continues to ramp up its daily testing capacity, which Health Minister Gan Kim Yong says now hovers between 11 and 12,000 a day.
By focusing on AI cases, it will already give us sufficient information. Over and above that, we are also, as I mentioned, doing surveillance testing on asymptomatic people with no symptoms at all, and these are critical workers, some of the essential workers. We mentioned that we are going to do a regular testing of some of them who are asymptomatic. This will also help to inform the MOH of the status of a community transmission. So I think some of these efforts are in place rather than to have a general random testing of people who walk in. I think it is better for us to have to focus our targets of our capacity in testing.
Now, Cheryl, with the general election looming, will candidates be tested?
Well, Steve, no, not at this point. There are no plans for candidates to be tested. And obviously, they will have to be well as they go about their campaign and their nomination activities. And also, candidates and supporters will need to observe safe distancing measures. These have already been put in place by the Elections Department, and they have already been designed to protect the health and safety of the public and those involved in campaigning.
Cheryl, give us an update on the latest overall situation here. Is the outbreak under control?
Yes, community cases, they do remain low, but the task force warned that we can perhaps see a spike in community cases as phase 2 continues. In the dorms, the foreign worker dorms, the situation is stabilizing. As of 23rd of June, about 120,000 workers have either recovered or have been tested to be free from the virus, and 80,000 have been able to resume work. And the task force said that by the end of next month, July, the task force expects 250,000 migrant workers, or about 80% of the residents staying in dorms, to be recovered or virus-free. And also when asked if the DORSCON level will remain at orange, the task force said yes. While there is no need to go back into circuit breaker mode just yet, tighter measures may be introduced again if community cases rise or a cluster is formed. And as you've said, we are a week into phase 2, and the task force did stress that it's really not the time to let our guard down, especially since there are pockets of individuals and businesses who may be irresponsible, and authorities will come down hard on anyone who doesn't comply with safe distancing measures. Back to you guys in the studio.
Thanks for that. Cheryl Goh with an update on the COVID-19 situation here in Singapore.